curious people. Today I am very pleased to introduce you to the second part of 19th century insane asylum's nightmare, and I want to thank you for continuing to watch this channel. And if you like what we do here, please subscribe, it's a huge help for us. Insane asylums were once seen as symbols of progress for people with mental health issues. But by the 19th and 20th centuries, these institutions had become overcrowded torture chambers. Philadelphia State Hospital at Byberry, Pennsylvania's murder house. One of the most infamous mental health hospitals of the 20th century is none other than the Philadelphia State Hospital at Byberry, where reports of violence between staff and patients were left unchecked, leading to a number of murders on site. The facility initially opened in 1903 as a working farm, where a few patients from other overcrowded mental health hospitals were placed. But eventually, the population grew, so much that the facility was turned into a full-fledged multi-campus hospital. The Byberry Mental Hospital's out-of-control growth made it difficult to recruit qualified people to work there. Many hires had no relevant background whatsoever, and were just brought in to fill staff positions. A lot of the anti-war recruits became valuable sources revealing the terrifying violence inside what became known as Byberry Mental Hospital. One staffer reported witnessing a patient stabbing another patient with a sharpened spoon. Other staffers alleged that some of the hospital's workers would frequently beat and abuse the patients. In 1919, two orderlies confessed to strangling a patient until his eyes popped out, blaming their actions on PTSD from the war. Despite the murder confession, the orderlies were kept on staff and even given a pay raise. Some patients at the facility would go missing, only to be found asleep on the lawn of a neighboring resident, or, in the most extreme cases, dead by suicide. Patient escapes were common due to the hospital's open-door policy, which enabled high-functioning patients to come and go as they pleased. In addition to common treatments like ectopic lobotomies, doctors at the Byberry Mental Hospital also performed a water cure. The heinous method of choking patients with wet towels was described in a 1946 report by the Philadelphia Record, which noted that one of the patients was left unconscious for 15 minutes following its administration. Medical procedures were commonly done without painkillers. Doctors pulled teeth without numbing patients with Novocaine, and at least one doctor who trained at the facility witnessed another doctor stitching up a patient's injury sans painkillers. According to them, they did so because people with schizophrenia did not feel pain. The pharmaceutical company Smith, Kline, and French, now GlaxoSmithKline, had also been allowed to open a lab at the hospital and conducted questionable testing of drugs, such as the antipsychotic drug Thorazine, on the patients, and likely without their consent. The forced drugging and excessive restraints on patients at the hospital began to grab public attention in the late 1970s and early 1980s. The horrors at Byberry Mental Hospital finally ceased on June 21, 1990, but decades later, the excruciating experiences of its past patients are still remembered. Bedlam, Europe's palace of chaoses, that turned into a circus show. Bedlam is the oldest mental health institution on this list, and it's also the most notorious, as its name is now commonly used to describe a scene of uproar and confusion. Officially known as the Bedlam Royal Hospital, Bedlam was founded in 1247 as the first hospital of its kind in Britain. Founded by the Italian Bishop Goffredo de Prefetti, it was built on top of a sewer that frequently overflowed and was meant to raise money for the Crusades through charity to the hospital. Later, the hospital morphed into a psychiatric facility. But along the way, it turned into a place to hide society's outcasts. Patients suffering from chronic mania and acute melancholy were housed together with those who had learning disabilities and others who had committed murder. Treatment at Bedlam included cruel experiments like inducing blisters, bloodletting, and rotational therapy in which patients were strapped to a chair suspended from the ceiling and spun around in 100 rotations per minute. The logic behind this bizarre method was to induce vomiting, which doctors then believed would purge the patient of whatever ailment was making them sick. But the therapy did nothing more than cause extreme vertigo. By the 18th century, the treatments at Bedlam worsened. Under British psychiatrist James Monro, the hospital shifted to surgical procedures. Patients were starved, beaten, and put in ice baths, another common treatment at mental health institutions at the time. Eventually, the hospital was moved to a more secluded location in Beckenham, which enabled better wellness facilities for patients. The government enacted reforms at the hospital in parallel with psychiatry's improved understanding of mental health. It is one of the very few mental health institutes from centuries past that is still operating today, fortunately under much more humane conditions. New York City Lunatic Asylum, the isolated island asylum. Many of the mental health institutions of centuries past symbolize the neglect and stigma placed on society's most underserved populations. These asylums often house those who were not actually ill, such as criminals, people with disabilities, and sometimes even immigrants. They were targeted because they were deemed unwanted by society, and thus, they were all banished together. No other institution signified this deliberate marginalization as much as the New York City Lunatic Asylum. The facility was built on Blackwell's Island, better known as Roosevelt Island, a small island in the East River of New York City. The island was dubbed Welfare Island because it also hosted prisons, almshouses, and hospitals for the incurable, an isolated area where undesirables could be hidden away. The island itself was named after Robert Blackwell, whose descendants had been farming the land before it was purchased by the city in 1828. The New York City Lunatic Asylum began taking patients in 1839. The harrowing conditions and abuse at the mental health hospital became the center of court investigations after they were exposed by a journalist named Nellie Bly. In 1887, she successfully went undercover as one of the asylum's patients and documented the facility's cruelty firsthand. She saw fellow patients both beaten and neglected by staff. They were cold and malnourished and were not at all treated with the dignity one would expect from a supposed treatment facility. At least one woman died during Bly's investigation. According to Bly, getting admitted to the hospital was easy, especially when rampant diagnoses of hysteria were commonly attributed to slightly troublesome women, but trying to get out was difficult. It was only with the help of a prearranged agreement with her editor that Bly was able to decommit herself from the asylum. Bly wrote her findings into an exposed series published by New York World. Her damning articles were later turned into a book called 10 Days in a Madhouse. Her reporting about the New York City Lunatic Asylum led to a court case that prompted a jury visit to Blackwell's Island. The institution fired several nurses who were exposed for their cruelty, replaced incompetent doctors, and was granted $1 million in additional funding to enact further reforms. The entirety of the island also went through reforms, with the public's increasing attention turning towards social justice and welfare. In 1955, the Metropolitan Hospital, which once occupied the asylum, was moved out of the building. The Octagon, which is the last remnant of the asylum, remained closed for many years thanks to ruin, fire, and decay. However, in April 2006, the Octagon was restored and fully renovated, and today is the lobby entrance to a set of sustainable apartment buildings. This is the end of the second part, and I hope you enjoy it. The last part of this short documentary series I will publish next week. And if you want to be sure that you don't miss anything, of course, only if I convinced you that it's worth it, it would help me to subscribe to this channel if you haven't already. Thank you.